Work? Yes, brilliant. Okay, well, thank you very much for having me here today. So I'm here today to talk about a paper I've written with Richard Palmer-Jones, looking at fertility decline in Kenya. Did financial inclusion play a role? So apologies, first of all, it's not a polished paper yet, very much work in progress. So I'm very keen to receive comments, and I try to stick to 20 minutes as well. If not, I'll resort to the flashing approach that we're all familiar with now. So that'll be quick and dirty, then racing through everything. Okay, so let me start out why we're looking at this topic, because you may say, well, it's very different to the sort of papers you've listened to this morning. Why is there potentially a link between fertility trends or fertility decline and financial inclusion? So what motivates us to do this? Well, this paper has been inspired by a paper we've done on a similar topic in the context of Bangladesh that's published in JDS, and we thought it might be interesting to actually look at the Kenyan or the sub-Saharan African context to see whether we can do something similar. Okay, so to motivate this paper, I've got two slides to kind of clearly say why we think this is an interesting paper to look into. So first of all, we thought, okay, we want to do something similar we've done before, but in the sub-Saharan African context. But what country should we select from sub-Saharan Africa? We haven't got the resources to look at all the countries there. So we looked at various countries, we looked at the fertility rates of these countries and how they've developed over time, and we found, as you can see from this graphic here, that Kenya has a very interesting story to tell. So Kenya has the purple line, which starts at a total fertility rate of around 8 in the 60s and really dramatically declines up to just under 4 in 2015. So we thought that's quite an interesting decline. And if you compare it to other regions in Africa, and the different colored lines here representing different regions in Africa, West Africa, Southern Africa, East Africa, Central Africa, and then the orange line is Sub-Saharan Africa as a whole. So if you compare Kenya with these different other fertility trends across the continent, you see that Kenya really stands out. So we felt there is a story potentially around the Kenyan context that we quite like to investigate further. But that's just a fertility story. So now you think, well, what connects it to financial inclusion? So we have another graphic here to kind of look how fertility develops when you bring financial inclusion into the mix. Okay, so this is a graphic based on demographic and health survey. So we largely use DHS data, really. So this is Kenyan DHS data, and that is having from 2014, where you find a variable that could be used as a proxy for financial inclusion, and that variable is called has a bank account. Not an ideal proxy, but that's the only one we can find in the data. So if you use that proxy for financial inclusion and plot it by fertility trends, you can see very clearly, or you disaggregate fertility by have a bank account or not, you can see very clearly that the respondents who haven't got a bank account, which is a green line up here, they have a mixed story to tell around fertility, total fertility rate. Okay, it hovers around just under 6 from the 1990s to around 2000, and then it starts to decline. But then if you look at the story being told for the respondents who actually have a bank account, you see they start off at lower fertility rates than the ones that haven't got a bank account, and actually the fertility quite steadily declines to just over 3 in 2015. So we thought, okay, nice one. So this is an interesting graphic. So maybe there is a link between financial inclusion and fertility decline in the Kenyan context. So let's investigate this further. So that leads us to these following research questions. So first of all, we want to look at the link between financial inclusion and fertility decline. I mean, these graphics do not tell you anything about causation. They just show you some lovely trends. So, but let's see, what really are the drivers behind all this. And then we are also interested to look at the link between financial inclusion and women's empowerment, because women's empowerment plays a large role in the financial inclusion context, but women's empowerment also plays a large role in the fertility context. That's the argument is that a woman's if the status of the female is improved in society, then that directly affects her fertility decline. So we look at the link between financial inclusion and women's empowerment, but also between fertility decline and women's empowerment. Okay, so you can see that's already being very complicated, because how these different causal relationships, how do they play out? How can we untangle this web of causality, looking at these very different complex topics? We use a range of data sources to help us unpack this web of causality. So we look at the World Fertility Survey from 1977 and 78. We look at Kenya demographic and health surveys, all the rounds that are available from 89 to 2014. We've also bring in Kenyan census data, but only the 62 and the 99 round. And then we use FinAccess data, which has been collected from the Financial Sector Deepening Initiative. And they have 4 data rounds between 2006 and 19. We look at this as well. So the paper is taking so much time because it's complex, what we're trying to deal with, and it's drawing on a lot of data sources that do not necessarily speak to each other. So it's been a very hard work, pretty much, has gone into this paper, and that's why it's not quite finished yet, because we had to grapple with a lot of measurement challenges, data errors, and generally the vast amount of literature on all these different topics. Okay, so apologies for the rough edges around the storyline, but I'm trying to put it all together in a sensible way in a very short period of time. Okay, so here we go now. So let's start off looking, and apologies that I talk a lot about fertility and only come to financial inclusion, but I promise I come to financial inclusion eventually. So look at the fertility trends in Kenya again. So we're using all the data we have available, they're giving us some fertility information. We're plotting this nicely, and we look at the total fertility rates from the 60s up to today. And again, as in the earlier graphic, you can see a lovely decline. Maybe, though, having also relating this to the literature, it's an initial decline, but you see a slight flattening out of the curve around the late 1990s and early 2000s, and the literature refers to a stagnation fertility decline, and then the fertility declines further from the early 2000s onwards. I come back to this issue, but it's important to remember there are 3 phases of fertility decline in Kenya. The first phase here up to the late 90s, then stagnations to the early 2000s, and then further decline from the early 2000s further below. Okay. It's also important to note that there are effects. Although I should note one thing before I move on. Fertility rates are still very high. So in the sub-Saharan African context, having a total fertility rate of around 4 may sound very good. But if you compare it to the South Asian context, which I'm usually more familiar with, you find, for example, in Bangladesh, the total fertility rate is near replacement level, around 2. So the African context still has higher fertility rates than the South Asian context. So African populations will continue to grow at a faster and more pronounced rate than in the South Asian context. Okay? So, and now let's move on to disentangling this, this earlier graphic I showed you by ethnic groups, because another complicating factor that we came across when looking at the data and also the literature is that we realized Kenya it's a very interesting country, but a very complex country as well, and it has to do with ethnic belonging and colonial legacy. So this is what I'm going to focus on slightly more now. Because we found if we then disaggregate the total fertility trends across Kenya, if we disaggregate this figure by ethnic groups, we find something fairly interesting. And that's what you find in this graphic here. It's again similar to the earlier one, plotting total fertility trends in Kenya. Again, same data sources, same time periods. But looking at the fertility rates of the different ethnic groups. Again, you can discuss how to classify these ethnic groups. We used linguistic groups to classify this. So we have the Nilotic and the Cushitic language groups and the other Bantu, and you see the Kikuyu are separate, even though they're Bantu speaking as well. But we found something fairly interesting with the Kikuyu, and there's quite a bit of literature also to kind of emphasize the story of the Kikuyu, so we thought we'd focus on that a little more as well. So what you see here on this graphic is that the Nilotic and Cushitic groups, they have a slightly higher fertility rate. They're the blue and the green lines. So their fertility rates are slightly higher when compared then to the other Bantu and also to the Kikuyu. But you see with the main groups, the Cushitic, Nilotic and other Bantu, it's a nice steady decline of fertility, you could say. But the Kikuyu group is very different. They have a very steep decline. Then they plateau, they have a rise in fact, and then another steep decline. And you wonder what's going on there, that the Kikuyu bucks the trend. Various explanations, which I'm not going into, but one of them is related to political power of the dominant ethnic group. So for example, Kenyatta was in power until the late 70s. Maybe the Kikuyu had a more prominent position then, more favorable access to family planning services then, which is something supported by the literature. And then when power changed to Arap Moi, there was a Kalenjin, maybe then there was a bit of a change. The Kikuyu were maybe slightly disadvantaged, but then when Kibaki came into power in the early 2000s, when fertility started to decline again, and Kibaki was a Kikuyu, maybe then the Kikuyu had more favorable access again to family planning services, hence it could have declined. But you may have other explanations as well, but that's something that's supported by the literature. And anyway, we thought there's something really interesting going on there. Why is the Kikuyu bucking the trend? So let's investigate this further. Okay, so there's a story around ethnicity, okay, something to keep in mind. But there's also a story around colonial legacies, okay? So, and that's what you see in the map here, okay? So this is the map of Kenya. And you can see what we try to do here is, again, we use the groupings, the ethnic groupings that I introduced earlier, and divided the country into these ethnic groupings. So you see the Kikuyu live very much here in this area, close to towns. The towns are the big black dots. The Nilotics are the light green. They're all over the place. Cushitic are concentrated more to the north and maybe to the kind of southern eastern bit. Then there's a big group of the northeast. There's Somalis and others will be there. And then you have the other Bantu that's not Kikuyu, which is the dark green. Okay. And then we also plotted colonial settlements in there. So first of all, colonial settlements in the form of these black dots that are towns, but also the boundaries of the White Highlands. The White Highlands were the areas where the European settlers would have traditionally moved to. And this is where you see the red line here, which is the boundary of the White Highlands. And interestingly, you'll find there are various ethnic groups living in the White Highlands. The Nilotics, so having said that, the Nilotics didn't always have a good relationship with the colonial government because they were actually raiding cattle and doing other things. And then you also see the Kikuyu living in parts of the White Highlands as well. And also here near the towns, you see a lot of Kikuyu dominance as well. And then other Bantu are closer to the railways. So the orange bit is the colonial railway that was connecting Mombasa with the interior of the country. So one could argue that, interesting, the fertility rate of the Kikuyu is lower compared to the other ethnic groups. And if you then look at the colonial settlements and proximity to living to these colonial settlements, we see that maybe the Kikuyu are living closer to these colonial settlements where more education and employment opportunities were maybe to be had, which may also explain why the fertility rates are lower compared to those of other groups, okay? So colonial settlements, and that's again argued by the literature, can bring about or influence trends, fertility trends through urbanization, education, employment opportunities. But of course, there may be geographical features to take into account as well. And the ethnic groups that living near colonial settlements, they had better access to education, employment opportunities, which in turn may explain why the fertility rate is a bit lower. Okay, so I put this out there, so I'll investigate and come back to this later. I said earlier that women's empowerment is an important factor because the argument is that if you try to link up fertility to financial inclusion, that is often occurring through the route of women's empowerment. So let's check out what the relationship between women's empowerment and fertility is. So there's a lot of literature, again, arguing that there is a strong link between women's empowerment and fertility. If you empower women, that has positive effects on contraceptive use, birth spacing, reducing fertility, and so on. But certain enabling factors have to be put in place, such as education and access to employment opportunities in order for women to be empowered, okay? And then obviously it's quite challenging to disentangle, the causal relationship between fertility and empowerment through these enabling factors. So it's quite complex and challenging to unpack this because lots of other socioeconomic and cultural factors are likely to influence fertility, as we saw earlier when I narrated the ethnic story and the issue of the colonial legacies as well. So a lot of issues playing a role and also interfering in the women's empowerment story. And obviously, if you then add in financial inclusion into the narrative, you further complicate this narrative. So I promised to come back to financial inclusion, and I am doing it. So here we are now, financial inclusion in Kenya. And this is something the governor said earlier in the morning. He narrated the financial inclusion rates having gone up from around 20-something percent, 26%, I think he had that figure even as well, up to 82%. So I think he used the same data source that I used, which is the FinAccess data. It's just that we presented it in a graphic way to illustrate how financial inclusion intensified over the period 2006 to 2018 in the Kenyan context. And the darker the shading in the map, the more financial inclusion. So you see in 2006 that It's maybe limited financial inclusion, 26% of the population, and that is maybe concentrated, again, remember the earlier slide when I said this is the boundary of the White Highlands and the railway line was going here. So interestingly, maybe that we have, I start flashing soon, I think. So interestingly here, you can see that financial inclusion may have spread along the lines of railways and the colonial settlements more generally. And then if you look at the intensification of financial inclusion, you can see here the darker shading, and now in 2018, almost all of the country seems to be financially included, okay? Right, so I've got to go quickly now. So the financial inclusion story, though, may be slightly disconnected from the 3 different phases of fertility. Remember earlier I said 3 phases of fertility. First and second phase ends around 2003, but intensification of financial inclusion really happened from the early 2000s onwards. So really what we can, with the data sources we have, can maybe only really look at the third phase of fertility decline from the early 2000s and see whether there's a link between financial inclusion or not, okay? Because financial inclusion wasn't really very intense prior to the early 2000s. Okay, so here are some results, okay, and I'll rush through them fairly quickly. So these are some graphics to show what the drivers or causes of fertility are, okay, and these drivers or causes apply to explain all the 3 phases of fertility. So urbanization plays a massive role. Respondents who are more urbanized are more likely to have lower fertility rates. Education plays a massive role. So if you are more educated, you're more likely to have a lower fertility rate. Wealth, of course, the wealthier will have lower fertility rates. But interestingly, and that's a cause that's not really explored an awful lot, and that's the one of ethnicity, and that supports the earlier story I told that ethnicity seems to play a role here in explaining fertility in the Kenyan context. With the Kikuyu, again, having lower fertility rates than the other ethnic groups. Okay, so let's look at empowerment now and the link between empowerment and fertility, which is, again, one of the research questions we wanted to look at. And here the story continues that education, urbanization, and plays a huge role to explain lower fertility rates. So this is a very simple multivariate analysis, okay? And you can see here, if you look at the direct indicators of women's empowerment, that increased participation in decision-making seems to have a positive and significant effect in terms of fertility rate. And, respondents who are more likely to participate in decision-making seem to have lower fertility rates than, compared to the other empowerment indicators. And I can talk more about how we calculated empowerment. We use the super index, okay? Anyway, something else we can discuss. And then again, here you find positive effects and significant ones for education, and the more higher you're educated, the lower your fertility rates. So it seems, and education and employment, these are indirect indicators of empowerment. Okay, the argument is that females who work or who are highly educated are more empowered than others, and this then may feed through into their fertility rate as well. Okay, so let's come back to the colonial legacies again. So we have established that the proximate causes of fertility, education, urbanization, ethnicity are all associated with lower fertilities, okay? So, and these in turn are associated with colonialism, okay? So people living closer to colonial infrastructure would be more educated and urbanized. This in turn is associated with lower levels of fertility as well, okay? So, and in this figure here, that's a figure to demonstrate this. The darker the shading, so the lower fertility is lower near colonial settlements. Okay, again, I use the railway lines and the boundaries of the White Highlands. So that's the light grey area, and the more fertile locations are further away, dark areas. So the darker, the more children were born. Okay, so the lighter the shading, the closer to the colonial settlements. So there seems to be a link to colonial settlements as well. Okay. So now putting it all together, and that's almost my final slide, putting it all together, I'm really racing you through this, putting financial inclusion and colonial infrastructure together to explain fertility trends. We're using the Kenyan DHS data from 2014 to regress financial inclusion. The proxy for financial inclusion has bank accounts, so we use that proxy and regress it by distance from the railway, and the results confirm the earlier picture I showed you, that having a bank account is less likely as distance from railway increases, so the rural dwellers are slightly disadvantaged here. Fertility of women in households with a bank account is lower than for those without a bank account. And again, the Kikuyu are more likely to be financially included than the other ethnic groups, and they also are more educated, more urbanized, and live closer to the railways as well. So all conventional correlates of demographic transition are correlated with financial inclusion and with the proximity to colonial infrastructure. And that's especially the case for the Kikuyu, as they have lower fertilities and so on, as we could see earlier. And I should mention this lovely graphic, which took a long time to do, so I must not forget to mention it. Again, Kenyan map. You can see again the railways here. The towns are black dots, which you may not see very well because they're overlapped by red and yellow dots. And the red and yellow dots are actually supply side, so mobile money or commercial bank outlets that are spreading across the country. And again, interestingly, you can see that the spread of commercial banks, microfinance providers, mobile money outlets, that's all very much along the route of the railway or within the boundaries of the White Highlands. Though having said that, more recently, and that's the blue stuff, this is the road network, in fact. So you can see some dots, some yellow and green, blue, red dots as well. That shows that actually now the recent spread of mobile money outlets is more along the road network rather than the rail network. Okay, so we kind of don't see this colonial legacy hanging over with the further intensification of financial inclusion. So really final slide now to summarize, and as more reflections. Yeah, more reflections than anything else. So we could see that we understand what drives fertility decline. So that's urbanization, education, employment, and so on. The effect of women's empowerment is less clear, but ethnic belonging, colonial legacies are quite important to consider. Access to formal finance has tremendously increased, especially for the poorest and the least educated, but access does not entail use or use in ways that would affect fertility in one way or another. FinAccess data shows actually that more than half the households that responded actually used the loans for day-to-day needs or education expenditure, which then begs the question, how sustainable is the impact of financial services on reducing poverty long term? So we actually have no certainty, or we cannot say with certainty whether financial inclusion caused recent changes in fertility via direct or indirect measures of empowerment, or whether advancements in these indicators was caused by the intensification of financial inclusion. Okay, and data limitations, measurement challenges were an issue I'm happy to discuss. Sorry. I feel it was a real marathon getting through this.
So maybe before, can I take my privilege of chair to ask a quick question? So empowerment, for instance, which is the channel, there is intrinsic institutional empowerment, which is have to do with participation, decision making. Is also there is the material instrumental, if you will, empowerment, which goes through income and so on. So I think it might be interesting to separate them out.
Yes.
Because, for instance, anyway, so the second one is about education. I think there is evidence that, you know, in West Africa in particular, in places that have been heavily affected by slave trade, that education leads to more children, not less. But education of women, for instance, can have effect on fertility. So instead of looking at education, for instance, it might be interesting to separate out between, you know, one or the other. Yeah. Okay. And last not least, in many areas, land fertility might lead to high level of fertility because you need more kids so that you can take them to the farm. So it's a factor that you might take into
you further complicate the story, indeed, yes.
Anyway,
we're aware of these issues, and we try to grapple with all this, but yes.
I'm not, okay. So 3 at the time. So you want to? Oh, okay. Yes, please.
A nice story linking fertility with finance. Okay. Do you think that inclusive finance will directly affect fertility, or directly or indirectly? I rather think that probably maybe inclusive finance will affect livelihood activity, and for that matter, the livelihood activity will affect either the stress, and then through that, the fertility will also be affected. That's my thinking.
Yes, thanks very much for a very fast presentation. But
I didn't have enough time.
a quick comment. Don't waste time going back to your second chart, but go back and have a look at it. And if you look at the fertility rate among the non-banked, you will see that it starts to take its sharp dip in 2007. And that, of course, is the start of M-Pesa. So it might be worth following that up.
Yeah.
One more? Yeah.
My question is about exactly how you establish causality, because infertility is quite a complex issue. There are many factors that cause infertility. So how do you imply causality between?
Okay. Yes, okay, so let me start with the second last question, with the dip in 2007. So that's the third phase of fertility, exactly. So that is what we want to explore, because the first two phases of fertility are kind of well established, the reasons behind this and so on, and it doesn't really connect with this financial inclusion intensification, because as you say, it's really from 2007 with the start of M-Pesa. So that's why what we try to do or focus on, and that's also where our data sources are helpful, is that we focus on the third phase of fertility decline, which is really from early 2000s onwards, because that's more likely to connect to the intensification of financial inclusion. But the data sources are really very limited. We only have one data round of DHS data from 2014, where we have variables for empowerment, fertility, and a proxy for financial inclusion. So this is the only data set we can really use to tease that out. Otherwise, it's just very difficult, because the data sources not really speaking to each other. So, but yeah, we're still grappling with how best to establish, well, that leads to the causality question, how best to explain the third phase of fertility and also establish causality. And coming to your point on establishing causality, yes. So it's largely correlational analysis that we do, because it's very challenging, I think, given the complexities that we're faced with, to really definitely say this is how causality flows in this particular context. Because some of the variables, you don't know whether education and employment are the ones leading to financial inclusion, or whether it's the other way around, or whether there are other intermediate variables playing a role. I mean, we played around with path analysis or structural equation modeling. I mean, that's something we want to go back to and explore a bit further. But when we've explored this initially, the results we received were not very conclusive, to be honest. So, but that's something that we want to revisit, maybe to kind of grapple with this causality issue in a better way. But that's certainly one of the challenges we have. What sort of empirical strategy should we design in order to unpack these very different and complex causal relationships? So, any ideas? Welcome to, please bring them on. But it's a real challenge for us to do this. And then the question on is there a direct or indirect link of financial inclusion to fertility? I can't say. Is there a link at all to financial inclusion? God knows, given that there are so many other factors playing a role. And every country will have other, like in the Kenyan context, we have ethnicity and colonial legacies really playing a role to kind of shape fertility trends. In other countries, these may be other factors that one has to think about. So it's very hard to, even an indirect link is very hard to establish. Again, it brings the topic back to how best to establish causality when you discuss these very complex themes and topics. So I don't really have an answer there. But there are lots of things, as you said as well, looking at land values and stuff, because there's a big story in Kenya around land as well. So there's lots of things you can bring in and discuss, and that we should consider. And maybe on your point on the empowerment, so yes, I mean, what we do in terms of measuring empowerment is very simplistic. We use this very recent super index that focuses on 3 dimensions. One is participation in decision-making, the other one is acceptability of beating, and the other one is social independence. That's very simplistic, and it's really kind of a summary indicator for empowerment. But I think we could, again, that's something we want to revisit and maybe see whether we can do better and grapple with women's empowerment in different ways. So we're not quite happy with the empowerment findings yet. Short answer.
Thank you.
Thank you very much.
I've been told that there will be no second round this time.
Okay.
The super chair made that decision.